Welcome, everyone, and thank you for joining us in a new episode of our People Power Health interview series. Today, we are really happy, really excited on having Dr. Joe Sakran here with us on this new interview. And first of all, Doctor, thank you very much for having the opportunity and allowing out the opportunity of having this conversation with you.
Yeah, thanks so much for having me.
Thank you. And the first thing that we will love to hear from you, Dr. Joe, is what was the first moment that you decided you were going to get involved with healthcare, to be a physician?
Yeah, so it's a good question, Sam. And I think all of us, or I wouldn't say all of us, but I would say the majority of us in healthcare probably have some sort of reason or drive that has gotten us to do what we're doing today. And for me, it was really personal. I grew up right outside of our nation's capital in Northern Virginia, the son of immigrant parents that came to this country in search of those hopes and dreams that I think so many of us strive for. And what none of us had ever really factored in or thought about or even imagined was that during my senior year of high school, I would go from being this healthy high school teenager to collateral damage after I was shot in the throat with a .38 caliber bullet. And I think, at least initially, that was part of my inspiration, of course, because I had been given this incredibly just unbelievable second opportunity at life because of the trauma surgeons and their teams that were able to make one methodical decision after the other to save my life. And I remember not too long after that injury, I had a ruptured trachea. I had an injury to my carotid artery, which is the big blood vessel that runs blood to your brain. I had an injury to my vocal cord, which you can hear my voice is a little bit raspy. And when I was out of the hospital for about a couple months, I still had a tracheostomy tube. And there was this one moment where I was standing in front of the mirror and I had these beet red scars up and down my neck. I had this tube in my windpipe. And what I didn't realize is my father was standing in the corner. And I think my dad saw that look of devastation in my eyes. And he came in and he said, "Listen, Joe, what happened to you was terrible. But you have two options. One is you can feel sorry for yourself, which I think is tough love, especially from an immigrant dad. Or the second is you can take this terrible incident and turn it into something that impacts the lives of other people." And it was really that moment that inspired me to go into medicine. It inspired me to become a trauma surgeon. And at that time, my whole goal was to try to give other people the same second chance that I was given. What I didn't realize is that as I went down this path, that my journey would take me beyond the bedside, beyond the four walls of the trauma center, beyond the four walls of the hospital, because I came to see that often the best medical treatment is prevention.
Thank you, Dr. Joe, for sharing your story with us. And I am curious, when I listen to your story and when I listen to you say how this path, this journey, how it went outside of the four walls of the hospital and how it went into other places, I'm curious. Did that happen like during the years of medical education? Did that happen once you were outside of medical school? When did you started to see that there was another way in which you could get involved with healthcare outside of the four walls of the hospital?
I think it started during my general surgery training after I finished medical school. And I think the reason it started there was I began to realize that despite how good we may think we are as clinicians, despite how incredible some of the surgeons that worked with, and now even I can look back and despite how amazing the training that I've had over the years, both in general surgery residency and in trauma critical care fellowship, the reality is that despite all of that, despite how incredible Johns Hopkins or any other health system may be, if someone comes in that is shot in the head, there's very little that I can do at that time to bring them back to baseline. And the best medical treatment for those patients is to prevent that from ever happening in the first place. And it was those kind of moments where I'm having to talk to moms and dads and explain to them that their child that left that morning is never coming home again. And those moments, I think, really have provided me with a different perspective to make me realize that, yes, like what I do as a clinician is important, but my voice as part of a community and society to try to put in policies in place that allow us to ensure we're building a system that makes people safer from these type of injuries, that is incredibly powerful, because that just doesn't affect the one person in front of me, that can impact populations.
No, yeah. And I can totally see and understand how, first of all, your personal experience, and then your experience as a surgeon that was training, helped you see the importance of preventing these situations from happening from the first time. And I was wondering, doctor, so you are one of the most important voices in the country related to prevention violence. And I was wondering, there is a very specific story about that tweet back in the day. And I was wondering, maybe I know you have maybe shared this story hundreds or thousands of times, but can we talk a little bit about that moment?
Yeah. So I assume you're talking about the moment that the NRA came after doctors and said essentially that we don't have our role to play in being part of the solution around gun violence prevention. And Sam, I'd first say a couple of things. One is, I think when we saw that, we were incensed, because you can imagine and it's not just doctors, it's nurses and techs and the entire healthcare profession, including public health practitioners, that have been at the center of taking care of these patients, have been on the front lines of having to talk to parents and loved ones and explain to them the devastating injuries and often deaths that we've had to witness. For any one person or organization to say that we didn't have a role to play, that really leads to only two conclusions. One is they either don't understand the complexity of the public health problem that we face, or they're not really serious about trying to move the needle forward. Because really moving the needle forward on this issue, it's not just about healthcare, but it's about bringing together all sectors, right, that cut across this complex problem. And we're part of the solution. And so just as policymakers are, and law enforcement, and so many other different entities. And I think that's really what drove us to respond to the NRA. And when they said essentially stay out of your lane, we said to them, this is our lane. And that's when I had put together that Twitter handle. And I just want to make it clear, it wasn't just me, it was individuals from different specialties. And it wasn't just doctors, it was, again, nurses and techs and so many people. For the first time, I think that I had really seen healthcare professionals were really impacting how the public thought about this problem. And the reason I think that we were so impactful is not because we told people of the 45,000 plus people that are dying a year from firearm related injury, but it's because we told those stories and in some cases showed those pictures of quiet rooms or bloody scrubs, right? And I think it's those type of communications that allowed us to translate the data and science into messages that every person in America and across the world could understand, which is the decimation of human life and the impact that not just this was having on individuals, but on families, on communities, and on a nation that continues to be re-traumatized time and time again.
No, I hear you. And I want to mention here that even though for example, I am based in Mexico. Even here, we learn about that situation that you were all going through, and how this organization made that statement, and all the uproar and the comments that were in creating the healthcare community. So again, thank you for that. And
But as you're based in Mexico, it's very interesting. You may know that right now there's a big lawsuit that's ongoing. And in fact, a lot of people don't realize this, but there are a significant number of firearms that are trafficked into Mexico from the US. And that's probably for a different interview and a different conversation. But yeah, no, I'm very well aware that the Mexican people are very much not just in tune, but understand the devastating, tragic nature of what is happening.
Exactly. And that's what some movement that started, and we can see that you also identify as a builder of coalitions, as someone that connects people. And I would like to ask you, Doctor, today we are 2023, we're starting these years. In which areas, in which topics, which specific projects you are currently involved with that you would like to share with us?
Here's what I would say a couple of things. First, when you think about, of course, I'm primarily known for my work around gun violence prevention, but I've been also talking about what's happening in America around the social issues in a broader context. And let me explain what I mean. When you think about health, right? If you put health at the center, right, of a diagram, health is so interconnected in so many of the social issues that we face, whether it's gun violence or COVID or climate change or immigration or racism or health inequities, right? And all of those different components are interconnected into health. And we as healthcare professionals, in general, I think, are trusted public messengers. The community and society, I think, typically trusts us. Not just doctors. I would say actually nurses are probably the most trusted.
Yeah.
And so we have the ability to have a voice in communities, to be part of the social change that we want to see. And one of the things that I've been doing, in addition to really trying to push some of the concepts and aspects that's happening around gun violence prevention, is to try to help train other healthcare professionals how to be part of the social change that we need to see, regardless of what they're passionate about. Because we get trained to be really good clinicians, but people don't train us how to think beyond the bedside and to really understand, like, regardless of what you're passionate about, how do you develop the skills to communicate those messages, to develop those public health campaigns, and to be that vehicle for the type of change you want to see. Right now, I'll give you one example. I'm working with a number of incredible gynecological oncologists like Dr. Becky Stone and Kara Long and others, and really a multidisciplinary team on ovarian cancer. So you might be surprised to say, okay, what in the world do you have to do with ovarian cancer as a general surgeon, as someone who focuses on firearm injury prevention? It turns out, in a conversation that I was having with Dr. Stone in the operating room one day, we were doing a combined case. And I said to her, I'm just curious, we haven't been able to really move the needle on preventing ovarian cancer because most women, as you may know, Sam, present in very late stages. And we know 1 in 78 women experience ovarian cancer. So it's quite common. And I said, why are we not just taking out the fallopian tubes after women are in the reproductive kind of phase? Because 80% of ovarian cancer actually comes from the fallopian tubes. So that moment led to this conversation, because Dr. Stone then said, don't move, I'm coming right there. I want to talk to you about this. And she said, actually, this is something that we're working on. Can you help us? Can you help us develop a public health campaign around this? And they have this incredible team that's working on this. And it's not just about the gynecological oncologist or that specialty in general. It's about a lot of us as surgeons who are performing abdominal pelvic surgery, that maybe if we're, like, say, taking out a gallbladder and, the person is done having children, maybe that's something that we offer them as a way to reduce their risk of ovarian cancer. So this is still in relatively early phases, but we're developing, and we have this team that we're essentially spearheading this public health campaign to try to, number one, educate healthcare professionals about the misconception of where ovarian cancer comes from and this opportunity of potentially helping reduce that risk. Part of it is also reaching the patients. So you can see that this is, again, an issue that is very specific, but requires a broad approach. That advocacy is so critical to that ability for us to scale across communities in the country.
No, yes. And now that you mentioned that, when I was in medical, I can remember very clearly that during the first year of medical school, I started to understand that, just as you said, that change that I wanted to achieve, for example, in the Mexican health system, it was not going to be able to be achieved just focusing on one specific detail, the clinical part of medicine, but that there were other determinants around. Economic determinants, poverty, homelessness, nutrition, etc.
Yeah, the social determinants of health.
Exactly, and how those other aspects and those other areas had health in the center. And it's very interesting because since a couple of years ago, when I started learning more about activism and about health activism, I started to realize how important it is to bring these topics into the clinical population, into healthcare professionals. So I would like to ask you next, what's your experience like when you are talking about these topics, about these campaigns, about the importance of public health with other colleagues? What's their reaction when you're talking with them about it?
I think that people are very, especially now, they're very open to understanding that we have the ability to have a voice beyond what we do clinically. I think where the struggle is not everyone knows, number one, how do you actually operationalize that? But I think number two is, as scientists, researchers, we can be wonky sometimes. And of course, we're so focused on the data, which the data, of course, is important, but the data doesn't change the hearts and minds of people. As from the teachings of Professor Marshall Gans and so many other incredible people, where we really try to focus on how do you go from value to action, right? And it's done through emotion, through being able to tell your story or the story of your patient, and to do it in a way that allows you to communicate the data and science that kind of pulls on the heartstrings of everyday people. And that's the skills and the talent, I won't say talent, but the skills that are missing in what I've often seen in a lot of healthcare professionals, because we're just not trained to do it.
Exactly. And one of the things that we have been discussing and sharing about People Power Health recently is how can these skills and how can these new areas of opportunity of experience can be shared with people. That's why we are recently going to launch a new program, People Power Health, called HEART. And this new program, the Health Equity Activism and Reflection Training Program, is just as you said, to how can we make clinicians, physicians, nurses have this training, have these skills so that they can achieve that change that they want to have in their communities, in their world. So I would like to ask, what message can you provide, can you share people that right now maybe are thinking about these topics, they know these are important things, but they are still struggling a bit to give that step and to get involved with health activism? What can you share with them about your experience so far getting involved with this?
I think, my experience has been that it takes time to develop those skills, right? It doesn't, like, sometimes I think we can be impatient and we want to see change tomorrow, but we continue to learn and to grow, I think, every year across our professional careers. And it's a matter of really understanding, I think, what are the skills that you have? What is most authentic to who you are as a person? And when you recognize those, you're then able to figure out, okay, this is what I bring to the team. What are the other missing components of the team that we don't have, or what are the components that we do have? And how do we kind of eliminate those gaps? And once you do that, you really put yourself in a position where, number one, you take the pressure off your shoulders, where no one person is going to be able to provide all the necessary components for every piece of whatever you're trying to do. That's why when you look at different businesses and startups, the most successful ones are the ones that bring together these multi-sector, multifaceted, diverse individuals. Maybe someone's from IT, maybe someone's from healthcare, maybe someone has a communication background. It's that collective, comprehensive group that allows us to be effective in moving that needle forward. And I think I've seen traditionally where like healthcare folks, we sometimes will like to stick to, what we know, it's comfortable. And we put together a group of, let's say, just since I'm a doctor, I'll pick on doctors. We put together a group of doctors, and that's great. And they're probably super talented and can bring interesting perspective. But that's not enough if you're trying to operationalize a social change movement where you need to impact populations. And I think that's where you start to think about the marketing piece, the communications piece, all the different components of it.
Yes, definitely. And Doctor, we have around 2 minutes left on the time for the interview. And there are two questions that I like to ask our guests before we finish these interviews. The first one, is there any person, dead or alive, that you will consider your like a hero for yourself, that you would like to, if you had the opportunity of taking a seat and having a cup of coffee or a cup of tea, that you would love to have a conversation with? And who will that be?
I think, look, there's a lot of people that I look up to. And I think one person who I've met before, but I think it has been really profound and impactful in how I've thought about approaching some of these different efforts has been Marshall Gans, who I mentioned. I happened to spend a year at the Kennedy School between 2014 and 2015. And I was just incredibly moved and fascinated by the ability to understand and how he's really developed the importance of public narrative and helped people, regardless of what discipline you're in, transform their interest into scenarios that have allowed us to really impact people beyond our profession. And I think that's a skill that, frankly, is so critical to being effective.
I agree. And the last question is there any book or any reading that you will share, that you will recommend people to take a look at, that maybe you find inspiring, or that you think that people?
Yeah, so one of the things that I think has been really fascinating is this book called Political Determinants of Health. It's by someone who is a good friend, Dr. Daniel Dawes, who is currently now at Meharry, but was the executive of the Satcher Health Leadership Institute, and is someone that is really just a world expert on health equity. And I think this book is fascinating because it goes beyond simply talking about the social determinants of health, but underscores the indiscriminatory policies of the past, like redlining and so many other aspects. And I think makes the point that only policy can fix what policy has created in the first place. And to allow us to understand that as we try to influence the structural changes that need to happen in cities like Baltimore and beyond, we have to think about those type of policies. And it's all packaged around what's happening around health in America, which I think those of us that are interested in that perspective have been trying to work on eliminating the inequities and really trying to develop a system that delivers high quality care to all Americans, regardless of your zip code.
Exactly. Thank you, Doctor. And yeah, this has been an amazing experience to having this conversation with you. Thank you again.
Likewise, Sam.
for joining us. And everyone, see you next time on our next video. Thank you for joining us.
Thanks so much, Sam.